Hello everyone, welcome to my channel. This is actually my first video that's not about music. The other day I made a video about medical costs in America and how expensive it is and how complicated it is. The topic was so complicated that the overall video became more than 1 hour, so I had to break into 3 parts. And one of my audiences said, why don't you make a video about medical costs in Japan in English? And I was like, that's a good idea. So here I am. So here's how Japanese medical insurance works. It's cheaper, covers everything, everybody's covered. That's it. Thanks for watching. Bye-bye. Nah, that's not gonna be a good video because everybody already knows that. So what I wanna do in this video is we're gonna take a look at how much medical insurance in Japan costs and what exactly they cover and how much it costs with and without insurance to receive medical treatment in Japan. And then we'll compare that with a case from America. Alright, so here it goes. Japanese medical insurance is mandatory. So that means if you work and pay taxes, you're already buying into this insurance plan. And what it covers is you have to pay 30% co-insurance. That's it. No deductible, no copay, just 30% of the actual medical cost that's also set forth by the government. If you're preschool children or seniors, your co-insurance can be 20%, but for most people, it's 30%. That also includes dental with no extra fee. And there's also monthly maximum out-of-pocket set. So depending on your income, if you pay more than a certain amount of money for medical services in a certain month, you can ask for a refund to the government. So unlike American medical insurances, your insurance kicks in right away. You only have to pay 30% of already set price and no deductible. So you don't have to worry about $1,000, $5,000, $10,000, even $15,000 deductible before insurance kicks in. It kicks in right away. Of course, no waiting period either. So how much does this too good to be true insurance cost monthly? It depends on your income and it's already set by the government, so you can easily find what your premium is. Here, for the sake of simplicity, I'm going to use exchange rate of $1 equals 100 yen. So let's look at the chart together. If you make less than $630 a month, your premium is about $57.24. But if you have a W-2 job, your employer has to pay 50% of it for you. So what you actually pay monthly is $28.62 per month, and the whole family is covered. If you make about $2,900 to $3,100 a month, then your premium is $296.10. But for W-2 workers, you only have to pay half of it yourself, so it comes down to $148.05. If you make more than $10,000 a month, your premium is $967.26. But again, if you work for a company, then all you have to pay is $483.63. That's much cheaper than what we pay for the family of 3 right now for our medical insurance. And we make nowhere near $10,000 a month. Unless you all subscribe to this channel and watch all of my videos. And then I make a little more than what we make right now. So go ahead and hit that subscribe button. And don't forget to hit the notification button either, so you'll get notified about my new videos. In America, you really don't know how much you get charged. It depends on your insurance, depending on the doctors and hospitals. So you really don't know until you get the bills. That's like going to a very expensive sushi restaurant and getting chef special, and everything on the menu is market price. In Japan, what they call medical compensation, which is the amount hospitals and doctors can charge for each medical service, is determined by the Ministry of Health, Labor, and Welfare. And it is much cheaper than US. In Japan, each and all medical services are assigned points, and each point is worth 10 cents. For example, medical code A000, which is first visit, that is 288 points, so that's about $28.80. And that's what you pay if you don't have insurance. And that's already much less than what I would pay for my primary physician with insurance in America. But what the patients actually pay with medical insurance is only $8.64, because it's only 30% of what the original cost is. A001, which is revisit. Now, first visit and revisit are assigned different points. Revisit is only 73 points. So that's about $7.30. And all you have to pay as a patient is $2.19. This is just for a visit, but this is the beginning. Now in my video about American medical expenses, I introduced this actual medical bill posted by Nick in California in 2013 on reddit.com. He went to ER and received appendectomy, and he was released. And his total charge was $55,029.31. What he owed was $11,119.53. So I looked up how much it cost in Japan to get appendectomy. And one clinic was stating average cost in Japan was $600. And this is same for any doctor or hospitals you go. All the medical fees are set by the government, and it's same anywhere you go in Japan. If you look at the breakdown of Nick's bill, operating room services is $16,277, and that's for the surgery. Japanese medical code K718, appendectomy, that's 8,880 points, which is roughly about $888. So what the patient has to pay is about $266.40. Look at this anesthesia, $4,562. Japanese medical code L001-2, intravenous anesthesia. Short term is 800 points, which is about $80, and what the patient has to pay is $24. So you can already see significant difference in medical costs in those two countries. And they're the same services, basically. If you're a foreign student, things get even better. You can get 60% discount on the insurance premium and 35% subsidy on your medical bills. That is on top of what's already cheap medical fees and insurance coverage. So in Japan, people rarely go bankrupt after illness. And nobody has to be afraid of going to the hospital, at least for the financial reasons. And the coverage is guaranteed, no hidden fees. And if anything should not be covered, then hospitals or doctor would tell you because it's such a rare case. And for medical providers, the payout is always guaranteed. So they don't have to worry about if the insurance covers this or not. And that is a good thing for the patients too. Patients usually pay what they owe to the hospitals or doctors at the end of the visit, and they will never ever get surprise bills later. Because medical providers know exactly how much they charge and exactly how much insurance pays and exactly how much the patient has to pay. So you won't get $11,000 surprise bill from the hospital like Nick did. So overall, the medical cost in Japan is very transparent, and medical care is affordable and accessible for anyone. Of course, there are problems to any system. For example, Japanese system doesn't provide as much motivation for medical advancement because the fees are set low. And you have to go through a rigorous government approval process for new treatments and drugs. So it takes very, very long time for new treatments to be approved. And one of such example is children's transplant. It is basically not allowed in Japan. So families with children who need kidney transplant, for example, they have to raise a lot of money to go to US to get that treatment they need to save their lives. And I don't know if you think this as a problem, but it's mandatory. So you can't say no to this insurance. But in my opinion, you're already paying for Social Security whether you like it or not. So this is just another one of those taxes that you have to pay for. That's how people think in Japan. Sometimes foreigners take advantage of this system by becoming a student in Japan and obtaining a visa. That way they can get necessary medical treatment for cheaper price. I don't encourage this, but I hear this happens all the time. Lastly, people abuse this system and go to doctors when they don't really need medical care. There's a famous joke in Japan that goes like this. Old people are gathering at local physician's office. And you have to remember, in Japan, they take walk-ins. So you can actually go anytime you want. So the usual crowd of old people are gathering and talking to each other. And one person goes, "Have you seen Mr. Tanaka lately? I didn't see him yesterday." And the other person goes, "Oh yeah, I haven't seen him for a while. He must be really, really sick." You get it? You go to the doctor's office all the time, but when you're sick and you can't go to the doctor, you stay home. Considering how cheap doctor's visits are in Japan, if you go there, everybody treats you nicely and you get to see your friends. So old people tend to gather there. This is unthinkable in US. If you did this in US, you'll go bankrupt. All the retirement funds are gone. There's also a famous guy in our neighborhood, and he would call ambulances all the time. And you have to remember, ambulances are free. And I don't know if he was actually sick or not, but he would call ambulances so often that they know each other. And one day, he asked the ambulance to take his bike with him so he can bike home, and they did it for him. If you use an ambulance like a taxi in US, that would cost you a fortune. So medical cost being cheap is a good thing in general, but people can abuse it, and that would come from the taxpayers' dollars. Again, I'm not here to argue which way is better. I'm just here to introduce you the way it works in Japan. I hope you enjoyed this video, and if you did, please hit the thumbs up. If you have any questions or interesting episodes in Japan, please leave them in the comment section. In addition to music-related videos, I'm planning to make more videos like this, which introduces interesting aspects of Japan. So please subscribe to this channel, and I'll see you in the next video. Thank you for watching. Bye bye.